Well, right now we have to, in order to see other people, we have to scroll down.
Yep, and I can take the slide down for now.
There's Howard Walensky. We'll say hello to Howard. Oh, that's
Hello,
great.
Leonard. Jennifer.
Hello,
Jason.
Dr.
There we
Walensky.
go. Hello.
Hello,
Hey,
Dr.
Mary Ann
Antowiak.
saying hello.
Hello, everyone.
Hello, hello.
Hello, everybody.
Perfect.
Hello.
Hiya, Mike.
Hi.
Michael Cohen's on. Good, Michael, show your face.
No face.
Good morning, Mary Ann.
There we
Good
go.
morning, one and all.
Hello, Marianne. Yes, nice to see you.
Same
Hello,
here.
Marianne.
And this moment
Hello,
has arrived
Jennifer.
after a lot of thinking and preparation for this, so it's glad we're here.
Here, here.
And we're so glad that we have our speaker who we do have today, that's for sure.
Hello,
Toby.
Dr. DeBasso. How are you?
Toby, welcome.
Welcome, Gerald. Dr. Detmeyer.
Hi.
Dr. Katz,
Hello.
John
Yes.
Ankoviak.
Oh, hey, John, my goodness, good seeing you.
It's so good to see you. I hate to bring it up, but I want to remind you, I'm heading for my 50th reunion with the university, and you were my first preceptor and mentor when I was a junior medical student.
Oh, my goodness. It's
Oh, and
how
it was-
time does fly, is that
Doesn't
the
it?
word? Nice,
good to
so
see
great,
you.
so great to see you.
Good
That
to
is
see you.
wonderful.
John, it's good to see you. How are things out in the sticks?
Well, the sticks, we had 38 inches of snow in 24 hours, so I don't see many sticks, but I see an awful lot of snow.
Right, right. Hey,
Hello,
Michael,
Dr. Sharif.
adjust your video, Michael.
Meaning what?
We can't see you.
Just the angle, Dr. Cohen.
There he is. Now we recognize him.
Oh, there's such a view.
Yes, we can see that beautiful view, right?
Yeah.
Oh, hello, Eric. Nice to see you. Thanks for coming on. That's great.
Eric,
Good
I
to
don't
see
any.
you, Len.
Howard, I don't see any.
And Susan, you're here.
I am.
Hi, Dr. Sutton. How are you?
Hi, Judy.
Eric, oh,
Oh, Fawad. Oh, Fawad, isn't that great that we have you on? Thank you for joining.
Judy, I haven't seen you forever. It's good to see you, Dr. Sutton.
Very nice to see you. Nice to be here this morning.
Well, great to have
Susan,
you.
hello.
Hello.
Morning. Sue, nice to see you too.
Good to see you, Judy.
Dr. Spalding is on. Hi, Dr. Spalding.
Angela, hello, Angela.
Good morning. Good morning. How you doing, Mike?
Good, thank you. And you?
I'm not complaining.
Eric, good morning.
Oh, wait a few more minutes and then we'll get underway. How's that?
Wonderful.
I like that sailboat. Look at that jib. Spinnaker.
Everyone realize we're celebrating our 175th anniversary of the medical school in AUB. How we looking, Tracy?
Good. We're at 35, Jen.
Jennifer, you should say that Howard and I represent the 175th class.
Oh, okay, we'll use that in your communications. I don't think so, but yes. Dr. Antowiak celebrating his 50th reunion, Dr. Cohen.
Yeah, I heard that.
He's a mere child.
He's a baby, right?
Thanks for saying that. My back's out, my shoulder's dislocated, and my trapezius is pulled off my scapula. But outside of that, I'm doing great.
You look good.
If you're still walking and talking, you're doing great, right?
That's right.
Okay. Okay, Dr. Katz?
Well, Jennifer and Tracy, yeah, I think we should get underway.
Yes.
All right. Well, I think we need to let everyone know that we need to have everyone stay muted unless they're going to speak. So there'll be a bunch of other people being admitted, and that's just fine. So we're very pleased. So let me start by welcoming everybody here. We're so pleased that on behalf of the Emeritus Medical Society at Buffalo, that we are continuing to sponsor our events, and this one is traditionally called a round table, but clearly we can't do this as a round table, so we're doing it as a Zoom. And the Zoom call makes it possible for us to gather quite a good group of people here today. So appreciate everybody for joining in. We are particularly proud to have as our speaker today, Dean Jean Witkowski-Wendy of the School of Public Health here in Buffalo, a very, very distinguished person who we are proud of in a broad way and very happy that she has agreed to speak with us today on the broad topic called the future of health. And I think she would like it to make sure this is clear. It's not health only per se, but public health perspective. While we're getting underway, I would like to say a little bit more about the people who are involved. As you see on the screen, you may be able to see Alan Lessie, Dr. Alan Lessie, who is the Senior Associate Dean for Curriculum at the medical school and a very distinguished physician who is helping understand what it means to prepare medical students for the future that's ahead. And that's what we're going to try to understand more about today. We were going to have an additional panelist named Michael Noe. Mike Noe, who is himself is an MPH in epidemiology and environment, and has been very active in teaching and trying to promote prevention and a lot of other very good things. Unfortunately, he has a health problem that's going to keep him from joining us today. But I want to assure everybody that he has told me he's had this problem before. It's a minor problem, and he should be back in action tomorrow. That's his hope. So following the panelists, after Dr. Witkowski-Wendy speaks, we'll have the panelists speak. It'll be Alan Lessie and I may join in a little bit. And after that is completed, we'll open this up for anyone who wishes to ask a question. With this number of people on, what we would ask you to do is to indicate that you have a question to ask. You can do that by going to the chat screen, or you can raise your hand, and our very, very competent people, Tracy Owen and Jennifer Britton, will watch for you and recognize you so that you can ask your question. Either of Dr. Wendy Witkowski-Wendy, or of Alan Lessie, or of me for that matter, or anybody else that you might. Well, just a few words about the Medical Emeritus Faculty Society. Here we are, the emeritus faculty of the medical school, and we maintain a very active existence, which is really quite remarkable, that we do a number of very good things within the medical and healthcare community. We have these roundtables. Later this year, we will have Dean Michael Kane, Dean and Vice President Michael Kane will be speaking with us, and we will definitely be looking forward to that. On an annual basis, we manage the Gold Humanism Honor Society inductions, and we happen to be proud of the fact that we actually brought the Gold Humanism Honor Society to Buffalo, which is named in the memory of Richard Sarkin and the Medical Emeritus Faculty Society Gold Humanism Honor Society. The other big thing that's going on this year, just fortuitously, this is the 175th year of this medical school, which is really hard to believe, but in fact, that is the case. that we were very early in the country as a medical school, and this is our 175th year, that there will be a big medical school celebration on May 11th. If I want to make sure I have that right date, and all will be informed about that later on as we go. Now, it'd be my pleasure to tell you a little bit more about our speaker today, Jean Witkowski Wendy. I'll start by saying I don't know how one person can manage all that she has done and accomplished. She is trained here, right here in Buffalo, and she has a master's of epidemiology and a PhD in experimental pathology, both with combined program of Roswell Park and SUNY Buffalo. So she's well trained for sure. She's probably best known for having been one of the major figures in the Women's Health Initiative, which everyone knows is one of the biggest trials, prevention and study trials of health ever undertaken. It started and began, and in 1995, I believe it was coming to its final conclusion. And under the leadership of Dr. Wendy Witkowski, Wendy, that indeed she led an initiative to create a continuation for northeastern states, and very recently received a federal grant of $8.1 million. That is what she is capable of doing, and we have seen it. She also has studied many other areas, research areas, including cancer, prevention of cancer, osteoporosis, periodontal disease, and oral health, and focused most recently on health outcomes. Her leadership and her roles have been enormous, and it is just a great pleasure that you have agreed to speak with us today. So as we move forward, I would like to just emphasize how important studies of this magnitude are. There were many publications that have come out of the Women's Health Initiative, that's for sure. One of the ones that I know impacted many people my age, our ages, for many of us, was estrogen replacement, which had begun to be a norm for women at menopause.
Coming up pretty well out of the
Computer.
computer where it couldn't before. Remember, I missed almost all the audio until Benjamin suggested a way, and I'm not seeing.
I think everyone needs to remain muted during this presentation, especially when our guest speaker speaks. So she was involved in that. She was involved in these current studies. She could spend multiple hours, I'm sure, talking about that. But in today's topic is going to look toward the future and the future of health, and particularly from a public health perspective. And with that, please join me. We can do it virtually in welcoming Dean Jean Witkowski Wendy to join us today.
Thank you, Dr. Katz. I really, really appreciate being here today, the invitation to talk a little bit about a number of different topics, from our school to what COVID is impacting to what I see as the future of where we're going in health and medicine, and maybe a few comments about some of the research we have going. But I'd just like to start by saying how many old friends and friendly faces on this. It really warms me to see so many people that served as mentors to me along the way, and I really thank you for being here. So as Dr. Katz mentioned, I'm currently serving as the Dean of the School of Public Health and Health Professions, and I thought it might be wise to take just a few minutes to talk about how the school came to be, and actually how it emerged, and how relevant it is to COVID. And though we have the 175th anniversary this year for the School of Medicine, our School of Public Health formed just over 100 years ago. And it actually was part of the School of Medicine. And date-wise, our school was actually, or a department of public health hygiene was established in our medical school as a response to the 1918 flu. And thinking about the relevance of that to the 2019 COVID, it actually is remarkable. We had a celebration about 18 months ago for the 100th anniversary and learned so much about how the Department of Public Health Hygiene was established because of the flu and how that transformed over time, eventually to become social and preventive medicine, which was in the medical school. And then that department, which was technically epidemiology, was the department that merged with health professions to become the new School of Public Health and Health Professions in 2002. So really interesting symmetries here that have happened. Now, that decision to merge and do a public health school was a long vision of Saxon Graham, who was our chair for many years and chair social and preventive medicine. It was actually Maurizio Trevisan who convinced the leadership at Buffalo to make this transition and jump to combine Department of Epidemiology with the School of Health-Related Professions. And from there, we were built. We had our first accreditation in 2009 and were reaccredited most recently, 2015. We're due again a year from 2 years from now, 2023. We're fully accredited both as a School of Public Health, but we're accredited in other disciplines, including physical therapy, occupational therapy, dietetics, athletic training, and we have shared the preventive medicine residency with medicine for many years. So I became dean in 2015, and I had such a great foundation to build off of. We had developed our full 5 departments by that time. We were fully accredited, and so I used the opportunity and the growth of the university under Dr. Tripathi to think about what we could be and do. And so we have been on a rapid trajectory of growth. We started when I became dean, we had about 850 total students in our school, mostly graduate professional. There was a national interest in growing undergraduate education. And so we went to town, and between 2015, actually 2017, when we got the approval, and now we have over doubled the size of our school in 4 years. So we went from 850 to over 1,800. And if you count minors and others, we're well over 2,000 students now. So it's been a rapid trajectory. Our biggest program is now an undergraduate program in public health, which we had planned over about 5 to 7 years to grow to 400. We've already done that in actually 3.5 years. It has led to a growth in our students that are now going into our graduate programs. This year alone, in 1 year, we grew by 100 MPH students. So we are at this point splitting at the seams with interest, and that all happened before COVID. Now, and as the medical school, nursing school, many of us see that health professions are really of interest. Everybody's applications are up. Ours are over doubled what we had last year. So we're trying to figure out how we're going to manage the future growth of the school. But overall, it's been just a great, great time. I've enjoyed this so much to be able to be in this position. As I said, it was 100 years ago that the Department of Epi was essentially formed because of the flu pandemic. And we all know this at this point in time, COVID has impacted everything and everyone. The spread has been unbelievable. Just being able to say 500,000 deaths in the United States this year, not even quite a year since the pandemic arrived, even in the place we are in, health and medicine, that we're still back to the basic public health practices. In 1918, the flu in Western New York we didn't get hit with comparable number of deaths as they were seeing nationally. And one of the credits was this new department and then the county health director really promoting social distancing, mask wearing. And it's surprising that those are really the tenets, again, that basic prevention is able to slow this down, help to protect, even though we haven't had universal use of this around the country and the world, those basic tenets are still very important. But it does make us understand that, as much as we can.
Yeah, I found myself.
Somebody's off.
I can get.
Okay, I don't know if Jennifer can remute everyone, but what's important is that these practices are again recognized. I think there are many people that just didn't understand that behind all the positive things that go on in the world in medicine are people in the trenches making sure our water's safe, our air is safe, that many practices that our food is safe, all comes from a focus on prevention and a focus on public health as a background. Now, when this all hit, for those of you that are not in the trenches at a university level, it was a need to pivot very quickly. And I can say that our university leadership, all our deans, all came together to try to figure this out. I think the health sciences overall played such a leadership role. I think I've got a busy life. Michael Caine's life right now, I couldn't imagine how he keeps all the pieces going. But, we essentially, in about a month's time, 6 weeks' time, had to figure out how to go remote on virtually everything, how we were going to accommodate students. And though many of us had used technology like this, I had never even heard the term Zoom before. I had used WebEx and some other, but we had to make this happen really quickly, be able to, in the mid of a semester, send students home, try to figure out in the health professions how we were going to continue those students. And you all know, because of accreditation, there's experiential learning that needs to be documented. Hospitals were trying to, shut down, extra people coming into those settings, nursing homes, with OT, PT, and my school, our students were being asked to leave their settings. We weren't sure how they would be able to get enough hours to graduate. But we came together. I oversee a group of clinical and what we call clinical practical, those disciplines like the health sciences in the colleges, audiology, pharmacy. How are we going to collectively figure out ways to get our students the technical experience they need? What could we do remotely? And how we were going to get them enough experience to be able to sit for licensure. And we did it. It was not easy. Our students were put through a big transition. In our school, we ended up luckily finding and hiring a technology expert that could just help us to manage. We weren't sure on that first Monday when things went remote, whether the whole internet was going to blow up or those students would be able to do things remotely, but it's been remarkable. As you all know, this is not typically what we'd be doing. We'd be in a conference room together, but we adapted. We also had to manage, state cuts to funding because the state was bleeding money economically. Things were shutting down. And I have to say, our leadership has, worked with us to try to resolve this. We were are a growing school, and we all were put on a hiring freeze because the state put a mandate on only exceptional hires. It made it very difficult. So we had to double up courses. We used a lot of adjuncts to help us out, and all the schools, all the health science schools were in the same boat. Our faculty and our university, I think, really stood up to be a model of participation. We work with the county health departments. Many of our students volunteered to help with testing or paperwork, became contact tracers, did whatever they could to help. We worked out a testing regimen that others then took part in. Some of the protocols we put together got shared with other universities who didn't have the expertise that we have. We turned to experts all over the school, in the medical school. Michael has taken such a large role in coordinating, but the work of Tom Russo and John Selleck and John Tomaszewski and Nancy Nielsen and Peter Winkelstein, and we can go on and on. Our own graduates, including Gail Burstein, who calls with us every week to try to coordinate the county with the university, use the expertise. So we've been very proud of how everybody has stood up and made this work. So it's been, in one sense, a big challenge, but importantly, I think it's opened up some recognition of what I'm going to call, by many terms, it's social injustice, health disparities, access, issues of nutrition and poverty that separates us from many of the people that live in our communities. And, in one sense, I'm very proud of the work that Tim Murphy, Alan Lessie's involved. We have representatives from our school that have worked with the community to try to do initiatives to work together. But nationally, as an example, testing for COVID vaccine in initial months was very scarce, and the testing was not being done equally in certain zip codes of even Buffalo, New York. And our teamwork with the community to recognize that and then work on solutions to solve it. And while the rest of the country still struggles with this, our testing rates in our communities have been pretty equal. As the vaccine starts to roll out, and it's been very challenging to get enough doses in everybody's arms, but we're thinking about those partnerships and ways we can make this equitable. But it does point a light on the fact that there have always been these disparities in health and related to social inequities, related to income, economics, poverty, access, and in addition to having the also recognition under the tragic death of George Floyd and others, that the movement on Black Lives Matter, both of these coming together, have shown us we need to do a better job in this area. And so although COVID has been tragic, it has shined a light on something we already knew, that health is not just about healthcare. Health is about equity, access, income, and many other factors. And it also is about what our school is focused on, which is prevention and wellness. And the idea that we often think about healthcare and how well can you treat if you've had an illness. What the focus needs to go to is how we can prevent, identify whether it's primary, secondary, or tertiary prevention, how to identify risk, how to mitigate risk, and how can we as a group intervene in these social inequities that lead to total life expectancy so much less in a Black man than a white man, and certain zip codes in certain areas that are of concern. So although COVID has been so devastating, I think it's helped us to regroup and think about what is prevention, what can we do in this area. And, if someone had asked me, often even my parents would say to me, what is an epidemiologist? What is it you do? Are you a skin doctor? The idea that now I can sit in front of the television and listen to a newscast and somebody's talking about public health, my epidemiologist, these are now common terms. And it's been, as I said, a boon for all the health professions are seeing uptake in student interest, but I think also recognizing what public health is and how we can move this forward. So, what are my predictions on the future of health and healthcare? I guess I'd say my predictions are my hopes, right? And this is something that we need more focus on wellness, and we need more focus on prevention, and we need more focus on equity, and we need more focus on getting rid of the disparities that occur. Many people misinterpret that that somehow it's the color of your skin that genetically makes you more prone to have a shorter life expectancy. And I can tell you genetics is a very small part of it. What it is these determinants of health that are not equally distributed in our country, in our community in Western New York. So for me, I think a focus that goes away from, treatment, having high-end treatment in the facilities we have in Western New York, we are so fortunate. But we need to go back to the beginning and say, what can we do about prevention? And those are simple concepts about basics of how we can start our lives better. I mentioned earlier that we're writing up an initiative, the School of Public Health and the medical school and the other health professions, to look at a large idea about how we can focus on nutrition in our community. So what people eat, how we're going to train our next health professions, what research can we do about nutrition, and how we change what happens in the meals and the food that gets into our communities. So we're thinking about it, that and prevention. Physical activity, our STEPS challenge that we do every year, thinking about what we can do that way. Being able to do screening. What positive things have come from screening? I do work in cancer. Just breast cancer alone, when you look at the mortality that was in the 60s and 70s and where we are now in terms of early detection, and mortality has dropped dramatically. So these are all important things that we need to do. I think a couple of lessons from COVID as well are the pandemic. I don't know if many of you listen to podcasts, but one my husband loves to listen to is TWIV, This Week in Virology. And they have talked about how many times we've had potential pandemics. So, SARS that happened, Zika virus, you name Ebola, that we've been able to kind of take back, but we were due for a large pandemic. And given so many different changes and, just climatary changes where we've expanded in the world, that we get closer and closer to vectors like bats that could interact, we need to be more prepared for that next pandemic. We need to be thinking about the impact of climate change on everything. Just, this week, the snowfall in Texas that, was so devastating, and, people that are losing their house, they froze pipes, and, these are the things that are going to happen. And how are we thinking about how we're going to manage those and be prepared? So again, back to social determinants. So as these things happen, if my pipes broke, I have the means to get this fixed. If you're on the edge of poverty, you don't have a network to support you, these can be like devastating issues. And we need to keep that in mind and be aware of that. One of the great things that I think we've been doing is the whole health sciences is our interprofessional education. We have got a program that is nationally being recognized, robust, that brings professions from all over the health sciences closely working together. We've even brought in students from law management to talk about the person as a whole and how to understand the intersection of this. And I think it's one of the things UB is going to be known for. So as we think about the future, I think there's going to be more need for collaborative practice, bringing in not just the physician, the nurse, but the therapist, the social worker, and trying to think about people as a whole, determine how we can do that. I think also our collaborative nature, I can tell you, I am so happy in this role. And it starts at the top with the president, the provost, the idea that we are a whole university that is working together. As deans, we're friends, we're not competitors. We're trying to do work together that advances all of us. It is nirvana compared to many institutions. And I think it's part of the culture of this region. And so I'm very optimistic that between the culture at the university and then our real connections with the community, we're going to be able to advance this region. And, in the area of health, I think we have a real shot at making this a much more fair and lucrative community. COVID came, and in epidemiology, we call them cohort effects. So these are major changes that occur. War is often, you look at World War I, World War II, changes in the economy, in who's in society. We had so many young men die in World War. It changed how we even adapted to cigarette smoking. This COVID change right now for certain age groups, COVID is the number one killer. It wasn't even on the coding scheme a year ago. I mean, infectious obviously was. So I think it's an opportunity where things will change. And where do I see some of those changes? So obviously in collaboration, telemedicine, it's going to happen. We already have many of the practices going forward. So how can we best avail that? It also is changing the population in general, their understanding. I'm worried in some sense the internet is a place where you can get lots of information, but you can get lots of misinformation. And how are we going to do that? Where we're with electronic health records and data, and how will we utilize them? They are still very flawed and biased when you're trying to really look at associations, but I believe they're going to get better and we'll be able to better use that. So, but at the same time, we are going to go back to the basics of prevention. I don't envision mask wearing or social distancing to go away, not this year, not next year. It probably is going to be a change for a long time, thinking about that, and then focusing again about the inequities that exist in this community and around the world. So I have hope that our interprofessional education and our collaboration across schools will continue. My School of Public Health and Medicine, we were born together and we still collaborate on many, many levels, not just in education, but in many of the research endeavors we have ongoing. And so I'm hoping that, these areas of inequity, providing what we're calling precision nutrition in our communities will all continue. We've been proud to have the CTSI to work with that has kind of put together the highest end research and allowed us to connect in many ways, not just across my discipline, medicine, but nursing and dentistry and all the health professions. I just want to, because I don't want to focus on my own research, but we've put in so many large applications, and WHI is one that I'm very proud of. I was at the time, just been 2 years since my graduation from this university, and was faculty then in the Department of what was called Gynecology Obstetrics. Myron Harishishin was the chair at the time. And Maurizio and I and others put together this application in 1992. We were awarded in 1993, did not expect it. The university had never had a large presence, but we put this in thinking we could learn from the pink sheets, we used to call them pink sheets, and go back in when they were calling for the second round. We ended up getting the award, and Maurizio and I used to talk that probably they were supposed to fund 15 centers. They funded 16, and we thought they tacked us on at the end. And we learned later that we were rated like the fourth best application. And it was only because we had so much support from the community. I remember Len going to you with support. You were running one of the early HMOs, and we were able to do it. As we learned early when Dr. Katz introduced me, we now just in October was awarded another 7 years of following these remarkable women. We had 4,000 women join from Western New York. We were the first center in the country to fully enroll our allotted amount. And these women are still participating, getting back to COVID. So we still have about 70,000 women alive and participating 27 years later. Wow. Out of the 161,000. And of those, we sent a questionnaire a couple months ago to these women. 50,000 of them answered a questionnaire on their COVID experience, just to give you an idea how robust this study still is. So by the time we reach 2027, this extension will have gone almost 35 years of a study of these remarkable women that live in our community and other communities across the country. And it's been such a privilege to be able to be involved in that. Have students, and looking at Marianne Rudkitka, I had students coming through our center as interns, and it's just been a pleasure. So I'm going to stop talking and open it up to the panel and hope to get some questions from everyone.
Well, Jane, how marvelous, marvelous. I think you really leave us with a sense of real hope about what can emerge. And you've also demonstrated what is possible to make happen. And I'll say what I said at the beginning. I don't know how you do as much as you do, but you do and do it so well. So why don't we start with our panelists first with Alan Lessie. What do you see in terms of the educational challenges ahead that we just heard about?
Well, thank you very much. And I'd like to echo what a wonderful discussion that was. The COVID pandemic provided a challenge for our curriculum, just as it did with the School of Public Health. We needed to make sure that we were true to our medical education program objectives and had to certify to the LCME that our students met all the requirements that they would have met in the absence of the pandemic. We did actually, as a result of the pandemic, develop several different alternatives for education in terms of modeling, such that our students on some of the clerkships would get the core clinical content remotely initially, and then they would enter the hospitals for their core clinical content. That actually worked out quite well because we could concentrate the information, and the students, when they were on the wards, were on the wards. They weren't going off for lectures and doing other things. So even in all of this, I joke, I shouldn't make any jokes about the pandemic, but you know, how the pandemic improved our curriculum is one of the potential outcomes of this. I agree with Dean Wachowski-Wendy. We have to concentrate on health. We can no longer define health as the absence of disease. We have to promote health and healthy lifestyles. And that's one thing that, as we're in the midst of curricular revision, hopefully start the entire process in 2023, we are looking at health maintenance as a major goal.
Maybe before we open it up, I would like to ask a question on behalf of Mike Noe, who can't be here. And Gene, what he was asking about is something you touched on, and that is collaboration. And he wanted to know if the effort is going to go to collaborate with community health organizations, with community health councils and health centers. Is that within your expectation or trying to make it?
Absolutely. And, you know, I can say for our school, we actually have hired someone whose full job is trying to connect with the community. But medical school has done this, this new initiative that Tim is leading with the community of color and health equity. These are all places that we're connecting. It's not just our education, it's our research. So in our school, we have, it's actually the Department of Nutrition, Exercise and Nutrition, but some of our faculty, Lucia Leone, the Veggie Van, how to do mobile diet access. She's working with many of the agencies in our community to help to optimize that, and we hope to grow that. So we cannot do it without connection to the community. And I think the university, all the health science schools, and even our upper leadership really recognize that we live in this community, we're part of this community, and as the community is made healthy as a whole, we all rise. So central to our mission, I think Alan would agree for the medical school.
Absolutely.
Excellent, thank you. And it's very, again, very encouraging and even inspiring. I'm going to ask one question and then open it to others. My question, I think you know what my question is going to be, and that is, as we look at healthcare in general, we began with treatment of disease, we began with prevention of disease, then we began to even recognize the social determinants of disease. I'm going to ask you a question about where we're going in terms of reaching health. And as Alan said so well, health is not just the absence of disease. Is there a way of looking at health beyond the disease orientation? Health having to do with well-being. So
Yeah.
I'll turn that back to you.
Yeah, I think what the goal should be is trying to optimize every person's both physical and emotional. We didn't talk much about mental health here, but both physical and emotional well-being or wellness. That should be, it's something that's given. And optimizing, meaning, we're all at different stages and paths, but how can we be our best selves, both physically and emotionally? And so that should be our goal. I mentioned to you earlier that often we say we want to improve health care. Of course we do. But underneath that, improvement of health care is improving health and wellness, physical and emotional. And I think that should be the focus. I'd rather talk about prevention of a disease than treating a disease once it's there. What can we do to optimize that balance?
Wonderful. Now let's open it to questions that could be, if you either raise your hand or send in a chat, we'll try to recognize. And Jennifer and Tracy are very terrific support people here. We'll recognize who is asking. Now I saw Larry Bean, did you have a question you would like to ask? I saw it come up quickly.
It's in the chat. Dr. Bean, feel free to unmute yourself or I can ask on your behalf. So
I'm
Dr.
reading the question myself. It says, talk about the intersection between public health and politics. What have we learned through this epidemic? Wow. So, we certainly have learned that politics can really be, depending on political stance, can be very challenging. We had a pandemic occurring, and there was a lot of inner fighting and poising and, where we were instead of getting to it. One of the things I think we all recognize is our public health infrastructure has been decimated over time. I was on the Niagara County Board of Health in the 1990s. And at that time, I remember how thin it had become. Federal and state money had been decreasing. They hardly had the infrastructure keep going. And that's over 20 years ago. It's been devastated around the country. And that's lots of different administrations have let that happen. But without getting too political, I think we had some major mistakes in communication, in ability to fund, that became arguments. And every one of these people that died while everybody was having this discussion as a public health person found it very frustrating. Thought the mixed messaging, lack of leadership on primary prevention, like masking, hand washing, could have really saved so many lives and so many people just getting infected with this disease. And we know now, so the NIH is now starting to send money out to study the aftermath of even getting COVID. So many people have these long haul memory fog and body aches and fatigue. And this to have 500,000 deaths, let me say that again, already this year, lots of mistakes made, but I won't get more political than that.
Thank you. Now we'll watch. I see John and Koyak, who I've known for 50 years. Go ahead, John, unmute yourself and ask your question. And I would just say for all question, either for Dr. Witkowski Wendy or for Alan Leslie or even from me. But I think most of them should be for Jean. So go ahead.
Well, I would like to address this to Jean, but to the three of you also, at the risk of approaching something political again, I'm going to go ahead with this. You know, I've been associated for the last 10 years with the Alliance of Community Health Plans, a Washington group, that the finest health plans in the country, health partners in Minnesota, et cetera, et cetera. And, you know, what occurred to me with other work that I've had in this community, we as physicians know what to do, and it's been verbalized here. We know we have to stress prevention and wellness. We know we have to have payment reform. We made some progress on that. What didn't come out much here tonight was we know the basis for a good healthcare delivery system is primary care. We have a lot we could do with that in this community. We also know, you know, with regard to once we get past prevention and wellness, we do have chronic disease, and coordination of care best practices are important. Electronic medical records must be embraced, but not in a competitive fashion, but in a fashion that record is available to everyone. So no vendor should be allowed to pass their record out without it being able to communicate to others. We know that. And we can do that on a local level. With the will and the people, the good people we have, is demonstrated. But you hit a wall after that. You hit a wall with these social and moral, not just social and moral determinants of health. Because, you know, Bernard Tyson once made this comment that at a meeting that I was at, where, you know, if you want health, or if you want life, liberty, and the pursuit of happiness, there are two prerequisites. One is health, and I think Jean pointed this out. Health, not just healthcare, but health. But the other part is you need a level playing field. So I'm finally gonna get to my question. I'm sorry, I'm not usually this wordy, but how do we approach this politically when we have a system where a good part of that political system does not even want to have the conversation? You know, we have to have universal health care. It doesn't matter whether it's single payer, double payer, triple payer, but you have to have universal coverage for everyone. And you have to deal with poverty, racial inequities. You know, I live in a little community where we have an outreach group. We were trying to give away turkeys and they wouldn't take it, you know, in the holiday season. And you know why? They didn't have a pot to cook it in. So, you know, how do we start the conversation at that level to get to the next level?
Excellent, deep question, and you really kind of cut to the core of some of the issues that we all face. I would ask Dean Witkowski-Whitney to start out. Would you have thoughts for him of how we start to bring about the sort of change? But I think you've been talking about change this whole time.
You know, it's, you know, things have become so polarized in this country. And honestly, I find it shocking, you know, that they have not. I think part of it starts with just, you know, fairness and economics. People cannot live in poverty or right on the edge of poverty without being at risk every day, every moment. Right. You know, I remember listening to a lecture Len Epstein gave probably 10 years ago, talking about just being on the edge of poverty and your ability to even think about anything else when you're worrying about food, your heat, and a small issue, a flat tire can just throw you into craziness. So I think we need to have fairness about jobs. You know, I did not recognize how deep racism was in this community. It just that, you know, however people are brought up to believe, there's differences that are attributed to your skin color or where you came from. Shocking to me. And I think it was the election of the previous administration where all this bubbled up. And I actually think I was too naive about these things. But I think it has to start with economies and respect and conversations. And we cannot pull everybody. I'm not expecting a lifetime of people that believe there are differences, that, I'm better than you or we're different in some way. I think we've got to start with kids and people that want to help and just move forward. Getting universal health care. Why is this such an issue in this country? We're just economically that we're treating people, and people that don't have the means end up in our system anyways. They just end up costing without the ability to pay for it. But we're all paying for this one way or another. Wouldn't it be better to give everybody access and start on the prevention route than the end of life or crisis therapy? But I think there's just this polarization. And, I think back to my own grandparents came over when they were just 14 years old, made a living. They never had an education, worked hard. And, Polish immigrants that at the time they were maybe on the outside, not good enough. But there was opportunity, and people recognized that everybody should have the opportunity to grow. I think, the people that want to make the strong message just need to keep doing it and moving forward. And, I'd like to hope that we can get universal health care and equity in the next 4 years, but it's going to be a longer haul than that. Enough me talking. I'd love to hear Alan and Len talk about their.
Thank you, Gene. Let's see if Alan, before John, we don't want to make it so much a debate. Let's see if Alan has some thoughts about your important comment.
No, I totally agree. It seems that when the discussion goes to arguing over what is a fact and what is truth, it becomes a fundamental difference that is very difficult to bridge. So I think there clearly has to be change. I'm not overly optimistic at the current time, but I think that we have to stay with it and continue to press on and continue to present facts and reason.
Thanks, Alan. I would just make one comment to John, and that is I surely have become over the years a believer in primary care as the essential starting place for major change within the healthcare world and the cooperation within the various sciences that we just heard about today. Maybe we can get in one or two more questions before we would come to adjournment. Is there anyone else who would like to raise a question? Just raise your hand. Good.
Dr. Terrace?
Lito.
Lito, and then Dr.
Unmute yourself, Lito. Lito Gutierrez.
Yes, I wrote it up in the chat. I guess that I'm concerned that we are getting too gloomy with this. I see opportunities. I see positive things that we have learned in the past year. Can we talk about the positives? I give you two. I think we have transformed the way we think about vaccinations and vaccines themselves. Number one. Number two, we are not going back out of telemedicine. Telemedicine is here to stay, will not go away. We need to get into telemedicine, the intimacy that we are able to get into in a person-to-person on the flesh encounter. Those are two positive things. And I think that I will walk away much happier if we can concentrate on that for a change.
Excellent. We all would like that. We've had enough gloom. Well, let's see comments about it. Gene, would you like to comment about his positives?
So I agree. I think telemedicine is here and will become great access for people in rural communities and people without transportation. If you have Wi-Fi, I mean, there's always that Wi-Fi or cable, but yeah, I think I still, on the vaccine side, we still have this challenge of people that are cautious of vaccines and not seeing this as one of the great vaccinations or one of the great successes of, polio, smallpox, you name it, and remarkable the way they progressed through the vaccine. Unfortunate that people thought they were short shifting. It's really just putting enough resolve around the size and the speed and the science that you could learn this lesson this fast and get it out to the community. So yes, very good points. Again, excellent points. The one thing I didn't mention in the last is, it's ridiculous that I didn't, but access to education, higher education, really can help transform as well. So, but yeah, some positives that have really come out of this.
Ellen, how about a quick aspect of you? Are students going to be introduced to and learn something about telemedicine?
Absolutely, and we've initiated that in the intercession during the pandemic, and it was quite well received.
Excellent. How about Jennifer?
Dr. Spalding.
One more question. Okay.
Well, that was my question, is what are you doing to introduce telemedicine? My sort of a corollary of that is we all took great pride in our physical diagnostic skills. But with telemedicine and also the many things that you can do with imaging now that were never available to us, how does that affect a course such as physical diagnosis? Does that still exist, and how are you modifying that?
It does still exist in the new curriculum, in the revised or redesigned curriculum. I think that we have to look at the emphasis for today. Does a student need to know the name of a name test that's no longer used and be tested on that? Or do they use a modality that combines physical diagnosis with other aspects of being able to examine, for lack of a better word, the patient either virtually, radiologically? I think that it's absolutely essential. We have to train physicians for 2030, not for 2020. And so we have to really be able to look ahead.
Jennifer, Tracy, you think we should be bringing this to our end? We said it's an hour long. We've gone a little bit longer. And I just want to thank Alan Lessie for joining us and adding so much to it. And it's hard to overstate what an extraordinary deep presentation Professor Dean Jean Wendy Witkowski gave us today. So we thank you, we thank you, we thank you. So, and I think with that.
Thanks for everyone being here. I really appreciate it. So nice to see so many friends.
Thank you.
All right, shall we bring it to an end? Thanks, everybody.